I'll talk about a few of these. Active immunization first started out with the compound, with the drug AN1792, but there's other ones such as ACC001, CD106, and still other ones that are still under development. This first agent was not pursued after it became clear it showed in about 10 or 15, maybe 10% of people, an inflammatory encephalitis, which wasn't good. However, passive immunization, so active immunization is still a reasonable strategy. The drug ACC001 did not show this inflammatory encephalitis, but did not show enough benefit such that it's not being currently pursued. Some of these other drugs are still being pursued as strategies to try to influence Alzheimer's disease in humans by decreasing amyloid deposition by provoking an immune response in the person itself. Passive immunization, however, has taken off as a perhaps slightly safer, although slightly more laborious, but potentially more controllable process of trying to go and introduce into people, into affected Alzheimer's disease patients, an agent which would bind amyloid and cause its removal from the brain. And so there's bapineuzumab, solanezumab, crenezumab, gantenerumab, aducanumab, ponesimab, and others. And each of these has slightly different characteristics. I'm going to go through a few of these drugs because these are the beginnings of the novel treatments for Alzheimer's disease, that one of which we hope will eventually work, a couple of which have at least failed at one level or another. So this is bapineuzumab. This was a phase 2 study looking at PET scans, amyloid imaging. And I think what you can see is that overall, there did appear to be some decline in the amyloid in the brain in people treated with the drug from the beginning of the treatment, before they were exposed to the drug, to a year and a half later. So here and here, there appears to be less amyloid on the right than the left. On placebo, it seemed like it was the opposite, that there was more amyloid with time, which is not surprising. So this sort of gave rise to the idea that maybe bapineuzumab or other antibodies really could clear amyloid from the brain of humans or prevent its increasing deposition. Unfortunately, phase 3 studies, which I was involved in, did not bear out a promise of clinical efficacy. You can see that the curves for bapineuzumab and placebo are basically superimposable. At the same time, there were side effects, and this is what we call ARIA, or amyloid-related imaging abnormality, which is edema of the brain. There were also little hemorrhages that could be seen, such as here. So basically, there were abnormalities in the brain, so we were giving people side effects, regretfully, in a percentage of cases, and we weren't seeing efficacy. So that led to this drug being abandoned. Perhaps we just weren't giving enough, but we couldn't give enough because when we gave more, we got more of these side effects. So that was the first amyloid clearing novel strategy, and as I say, it didn't work at the dose it was given, and we couldn't give more. However, there were some subtle hints that it might be doing something good. You can see that overall people with bapineuzumab on sub-study analyses did seem to have a little bit less phospho-tau in their cerebrospinal fluid. And overall, there seemed to be some effects on brain volume and PET signal that suggested that maybe the drug was accomplishing some measure of action in the desired or designed fashion. So a more modern drug of the same category that tends to attack fibrillar beta amyloid is called aducanumab. Many of you may have seen in the news, and it is a drug which is ongoing in phase 3 testing right now, and certainly at a PET scan level, it seemed to have similar features to bapineuzumab, but even more striking in the sense that it really seemed to be reducing the amyloid in the brain, but at very high doses, it really seemed to have a lot of side effects. So at the highest dose tested, 10 milligrams per kilogram, over half of patients, or about half of patients, were having vasogenic edema or microhemorrhages or serious side effects, which were actually symptomatic, unlike some of the side effects, like the majority of the side effects seen in bapineuzumab. So this drug clearly was active at reducing amyloid, but it was also clearly active at causing side effects. We'll see what the results of that study, ongoing study, which should come out in about 2020, will show us. A different strategy of attacking beta amyloid is to attack soluble beta amyloid less than fibrillar. The idea here is that if we go and remove the beta amyloid and in smaller units, maybe it won't get together to make fibrillar amyloid. And maybe by sucking off soluble amyloid, so to speak, we might have decreased in the degree of plaques, period, due to some equilibrium effect. So in phase 2 studies, it looked fairly encouraging, at least by various analyses. You can see a separation of placebo and drug in 2 different studies and in pooled results. This was true in the mild cases. However, it has been given a phase 3, actually that was phase 2 trials, I'm sorry, those were the first 2 phase 2 trials. Now in the 3rd phase 3 trial, which I presented this past fall, December, clearly the drug at the dose we were giving it did not show adequate efficacy. The good news is it showed no side effects that we could tell whatsoever, but you can see the curves are not so impressive here. There's about 11%